Hi, I'm Scott, your joint pain specialist from San Jose, California. And today we're going to talk about plantar fasciitis, or the bottom of the foot, which is the plantar side, okay, planting, so the bottom of the foot, usually in the heel, but can also be pain in the arch of the foot. So, heel pain or through the arch of the foot. So we're going to talk about what muscles are actually, what's going on with the foot that's causing this, and we're going to go over the most common treatment to eliminate plantar fasciitis the most successful and fastest way possible. All right, so without further ado, let's get to the body.
Okay, so here we are looking at the foot. All right, so these are all the muscles of the foot and the bones and ligaments and tendons and all that kind of stuff, okay? We're going to look at, we're dealing with plantar fasciitis. So usually the most common symptom is pain through here, okay? But you can also have, those are all the muscles of the foot. There, we're missing a few there. Sorry about that. So right through here, see where all these muscles attach to the heel, what's called the calcaneus, right through there, okay? That is usually the cause of that pain. Now, what's going on here? Well, the most common cause is actually, it's not these muscles specifically, but they're part of it, okay? But it's more this muscle right here. Okay, this plantar fasciitis. It usually what's causing it is the foot loses its ability to create a proper arch in order to create a bridge that gives you leverage to push off your toes. Okay, so if we look at this foot here, take out like this view. Okay, let's put back the muscles. Clear that screen. Okay. You have this little an arch, okay? And it doesn't matter if you have a smaller arch, a natural small arch, or a natural big arch. That's not what's important. What's important is that your foot's ability to create an arch, okay? So what happens if the body gets overstressed, then the body will create a compensation. And this compensation is a default to minimize stress going into the leg, all right? And the best way to do that is to create a permanent parachuting movement with the foot. Okay, see, when the foot comes down to heel strike when you're walking, you heel strike, and then your foot comes down and your toes hit the ground, and then what's supposed to happen is all the little bones here. Let's see all those little bones right here and these bones and everything, they hit the ground, and as your weight goes onto it, they collapse, causing a shock absorbing movement. Okay, that's what pronation is. Okay, pronation is shock absorbing for every joint, but in this joint we're talking about specifically is the foot. So all these joints here, they're designed to shock absorb so that you're not putting a ton of stress on the leg, okay? And then I want you to notice something right here, okay? Look at this, you look at the heel here, okay? That is one solid piece of bone, all right? Now when you're walking, it's no big deal. You're not putting a ton of forces on there or anything like that. But when you're running, it's not really good to put a ton of force on this solid piece of bone because this one single bone doesn't have a lot of give. All these little joints here and here and here and here and here, those are all, and then look at all these right through here. These are all joints that are designed to distribute stress. Okay, so when you're running, it's better to land like midfoot or on your toes, because that's going to create more of that parachuting, that pronation, that shock absorbing. Okay. But anyway, sidetrack. So what happens is the body goes into a protective state and it goes into this permanent like shock absorbing state, all right? Because too much stress or whatever, and the body's just trying to prevent it from getting further injured, okay? So what ends up happening, let's see if we can go back. Okay. All right. what ends up happening is this muscle, because it's in a permanent shock absorbing position, it's lengthened. And normally what happens is the foot comes down and lands, parachute, shock absorb, and then as the weight comes over, the muscles then work with the bones to create that bridge, that little arch, that then gives you leverage to push off your toes, okay? All right, that arch is what's important, okay? But in this case, what ends up happening is because the foot has lost the ability to create that bridge and create that arch, you come down, you hit, you shock absorb, but it doesn't do that, and it over lengthens and puts a lot of extra stress on this muscle, lengthening it out and causing damage, okay? And then that damage starts to harden and starts causing the symptoms that you feel of pain. Okay, let's back that up. Okay, so now that we know what's the main cause of that, let's go check out how we can correct it. But unfortunately, not 100% of the cases that I've seen requires working on just the foot. A lot of times there is something that's underlying. I find that if there's a foot issue, there's also a hip and trunk and spine issue. And if you don't fix one, then the other just keeps on coming back. So I really recommend people getting assessed so they can have a personalized exercise prescription to help correct their problem. And if you want, you can have my team of me, myself, and I to do that for you. And for $50 a month, I will personally assess you and then write an exercise prescription for you to follow. Okay, that is specifically tailored to you. No robots, no anything. All right, I'm doing this for a long time, so it's not too complicated. And the best part is we can communicate through the my system, which is also an app. You can download the app and have it available on your phone. No problem. We can communicate right through there. It's very beneficial. All right. Okay. Now let's go check out these exercises. All right. So you see here, there's a bunch of exercises and mobility stuff to do. A lot of them are daily. Okay. There's only really one exercise that's going to be done a few times a week. But the reality is you can do that daily as well. I would recommend starting off the first, at least a week or two of just doing it 3 times a week as I have it prescribed here, which is this one, the towel crunches. Okay, and we're going to go over all these. But if it feels fine and you feel like it's not too stressful for your body, then you can do it daily. All right. Okay, so let's look at plantar fascia, mobility ball, myofascial release. All right. Okay, so notice here that we're using a tennis ball. Okay, you really want to make this something that's soft and gentle. All right, you don't want to use a hard lacrosse ball. At least that's my recommendation. All right, I find that it kind of can do more damage than benefit, and then also you don't want to like put all your weight on there. Notice how there is weight being pushed down. Like you can see how the ball is being pushed on, but it's not a ton of force. Okay, so on the description it talks about having either a sock on or barefoot and be standing, but you can do this seated as well. In the very beginning, I would highly recommend seated, and then just seeing if your leg weight is enough, because you don't want it to be like, you don't want to be sharpshooting pain, and you want it to be a tolerable, dull, aching pain. Okay, at the most. All right. The whole point of this is to try to get some range of motion and mobility. So a lot of times the lengthening of it hardens the tissue and loses the ability to be able to make the muscles get shorter and longer, even anymore. So breaking up that tissue, that's the wrong, I shouldn't say that, not breaking up the tissue, but getting some movement in your foot is ideal. So how you want to do this is you want to cover the entire foot. Notice the toes are elevated, okay? They're elevated. They're not like down, all right? So you're not like pushing down with your toes or anything like that. Your toes are up, all right? So keep the toes up the whole time. And you're basically going to roll it from however far forward you can go with the ball of your foot, all the way back into the arch and then into the front part of the heel. There's really no reason to get into the back part of the heel because that's getting into these calf muscles. That's where they attach to. And that's usually not the big problem. The problems are all through, like right through inside here, this part of the heel, and then forward. from there, okay? If you find a specific spot that's really painful, like there's just like one little tiny spot that's like really painful when you get there, try to relax and try to be there for about 10 seconds or so. You don't want to go really long, all right? But try to relax and feel if that pain kind of goes away by just hanging out there for just 10 seconds and then move on, all right? The longest you're going to want to go is like 1 or 2 minutes, but then you just want to follow it. Let's check out the video, see how it's done. So toes are up, nice and easy, just rolling from the ball of the foot all the way to the front of the foot, okay? Trying to impact, you know, all of these muscles, right? You're not gonna be able to just pinpoint one, all right? But every single muscle right here in the center of your foot, right through here, but the big one's gonna be right in there, okay? Okay. Let's go back to the next exercise. All right, towel crunches. All right, this one is actually going to be really beneficial for this one right here. These flexor digitorum brevis muscles. Okay, you see how they come all the way up and attach to the toes. So we're not really too worried about the big toe. All right, you still want to do it, but you really want to do these guys. Okay, this big toe one, the muscle that works on that one, actually, you see, it goes all the way up to calf and everything. So you definitely have calf muscles that help and do things and everything. But the most important thing about, for this protocol that we're talking about, if it's just this foot and the arch is the problem, you want to think about the little digits here. Okay, they call these things digits. That's why it's called digitorum. Those are the muscles that you want to focus on for this one. Okay, and it's really simple. You just have your foot there, and then you just crunch the towel, trying to pull one end of the towel towards you. Really try to make sure you're not lifting the heel up. You want to be seated. Everything is relaxing. Really, it'll be really easy for you to try to use your hamstring and kind of like bend your knee and pull, with your leg. You really want to focus on just those toes. Okay. Let's check out the video to see how it's done. And then just spreading toes out. And see that? Really extend the toes out as far as you can, and then grip and pull in. Okay. Obviously, the big toe is going to be involved. It's going to be pretty hard not to use it, but you just really want to think consciously about trying to use these other 4 toes, not this great big toe right here. Okay. That's what hallucis stands for. It's Latin for the great. All right. Okay, here's a real important one. Okay, and this is very difficult. Hopefully you'll be able to see it on the screen when I show you the video, and you barely see it here with just these stills. But if you look at it right here, see how the foot is kind of flat right here in comparison to here? There's a little bit more of an arch. So what's going on here is you're trying to use these muscles here and trying to squeeze the muscles to pull these bones up, okay? Remember these bones here? Let's get all the way down, okay? You're trying to get these bones here to go up that direction, all right? So you want to think about these muscles here, right? These muscles here, how they're designed is they need to shorten, right? If they shorten, then the bones come up, creating that arch. So you want to think about and really concentrate on squeezing basically all these muscles, honestly. Everything, everything. They're all part of it. I mean, obviously the big ones are this one and the muscle below right here, but all these muscles are going to be working, okay? So really think about trying to squeeze those foot muscles to pull up, and you're going to want to hold that there for about 5 or 6 seconds, okay? 6 seconds would be better, but 5 is good enough once you get to that top point, okay? Let's check out the video. See how it's working. See how it's squeezing up and down. Squeeze, hold it for about 5 or 6 seconds, and then let it relax. Try not to cramp. If you're cramping, then you're either in a bad position or you're pushing too hard, okay? It should be gentle, it should be easy. We shouldn't create a huge arch right the very first time doing it. It's gonna take time, right? You spend however long dealing with this problem, it's gonna take time to reverse it. All right, let's go to the next one. Okay, Pretty self-explanatory, standing calf stretch. The big one on here is feeling this lengthening, but feeling the front part of your calf, okay, flexing. All right, let's check this out on the body. All right, so we have this thing, this law. Okay, it's a law of movement, all movement. It's called reciprocal inhibition. All right, no one knows what it's called, but everyone's heard of it before. In order for me to bend my elbow, one side of the joint, my elbow joint, muscles have to shorten. The other side of the joint, muscles have to lengthen. Okay, that's basically what it is. That's what's causing, that's the reciprocal inhibition. Okay, so in order to create a permanent lengthening of these muscles here that we're going to be shooting for, these calf muscles, these gastroc muscles, you want to think about this front calf muscle here, your anterior tibialis, okay? They have listed tibialis anterior, whatever. You want to think about that muscle kind of like pulling your body forward. And then it might be beneficial also to, see if I can back this up, get that glute engaged as well, okay? Getting that glute engaged, you see how it comes all the way down and attaches to the knee. So the glute attaches to your IT band right here, and that you actually have nerves that come down as part of the glute and attaches on the tibia right through here. So you have the ability to pull on the lower leg muscles with your glute. Okay, so it's a good idea to engage the glute and pull yourself forward using this muscle, and then some of your, these top foot muscles over here. Okay, on the dorsi side. So that's the dorsi side, the top of the foot. We call that dorsiflexion. And then the bottom of the foot is called the plantar side. We call that plantar flexion. Okay? Vocabulary just so we can communicate stuff. All right. So now let's watch the video, see how it's done. You can use a chair, you can use a wall. You don't have to use a chair. You can use a couch, whatever. It's not important. What's important is that you're not hyperextending your low back, right? That's part of the reason why you want to squeeze that glute, help protect your low back, along with also trying to helps like with the whole chain, because everything's connected. I don't know if you've heard of this before or anything, but everything is connected, all right? So by engaging all the muscles here in the glute, the hamstring, and then the front of that calf, you're going to be able to create permanent lengthening benefits to help out with that plantar fasciitis. All right? Okay. So now we're going to look at the Soleus Stretch. Okay? So the Soleus Stretch is very similar to the last calf one. Okay? But instead of it focusing on this big gastroc right here, let's see if I can get through it right there. It's focusing on this soleus. That's the name of the muscle. All right, and it's a deeper calf muscle, and yep, there's an even deeper one, right here. Oh, that's a hallucis longus, posterior tibialis. There you go. Kind of, yeah. That's like the deepest one right there, right? Yeah. Okay, but we're talking about the soleus specifically. All right. So we're gonna try to lengthen that. The only way that you can do that without also lengthening and putting a lot of focus on that gastroc is by, instead of keeping the leg straight, you bend the knee. And you want to think about trying to, with the top of the foot, push your knee forward, okay? Still engaging that glute, protect that low back, right? Now, if your knee caves in, you're going too far, okay? If your knee caves out, then you're not squeezing your glute the right way. You gotta make some adjustments and get that glute firing, okay? So if the knee goes out, that means you're using your hip too much. If the knee goes in, that means you're going too far and your foot doesn't have the mobility to continue going forward, okay? So really try to think about maintaining the arch in that foot that you created and leaning forward for that. Let's watch out the video, see how it's done. Engaging the glute, squeezing that knee forward. You see how she's just sinking straight down, but the big focus here is pushing that knee forward, okay? Very simple. Okay, single leg balance. Now this is an interesting one for a lot of people because everyone thinks that one-legged stuff is core. And yes, it's true. There is a core factor in this. No doubt, right? Core is the center of the body. You're using it all the time. At least you should be using it all the time. But there's this thing that's called proximal support. And what proximal support is a stationary lever that your body uses to generate force, okay? So an easy example about this is like a seated row machine, right? Where you have the chest pad up against your chest, and you're leaning against it, and then you're pulling back, keeping your body up against the padding there. That's proximal support to put more forces into the arms and back specifically, okay? When you are not on a chest pad machine and you're like sitting on a seated row bench, and there's no chest pad machine, it's just your bench, then the proximal support is your hips and your feet, right? So there's it creates a greater focus of your core to maintain stability in order to create that same type of movement, okay? But what ends up happening a lot of time, you see this all the time in the gym, people are like swaying back and they're using their lower back. Why? Well, that's because the proximal support is on their butt, and the closest joint that hits the proximal support is what has the ability to do the most work. That's how come it's better if you're wanting to work your back to have that padding on your chest so that you can have proximal support for your back so you can have more focus on your back. Now, there's no such thing as isolating muscles. You're going to be using your core, you're going to be using everything, right? But it just allows to have a higher level of focus on those muscles. Anyway, so here, the proximal support is the ground. So when you come up off your foot, this is actually a major foot exercise, okay? You're having to use all the muscles in your foot in order to stabilize. That's what's working. I mean, yeah, you got to engage your core so you don't fall over or anything like that, but I mean, the closest thing that's keeping you on the ground is your foot. So one-legged exercises is way more of a foot exercise than a core exercise, okay? So let's check out the video and see how it's done. So lifting the leg up. Now you don't have to lift the leg up that high. What's important is just having the foot off the ground, okay? So if it bothers your hip or anything like that to bring your foot up that high, you don't have to. You want to just bring your foot up so that you're completely on one leg, and then you're thinking about maintaining that same arch, right? You want to feel that same arch, of your foot working, all right? And just holding it there for like 5 or 6 seconds if you can. I mean, if you can do 30 seconds, like it says in the description, right? Attempt to bounce for 30 seconds. That's a long time, but 5 or 6 seconds is plenty. Okay, single leg heel raise. All right. So remember, let's see. One more there. Okay. So this isn't the main muscle for what we're working on for this heel raise, okay? But if you look, check it out. All right. This deep calf muscle right here, where it all bulges up, comes and attaches right where the foot arches up, or where it's supposed to. Okay, so this is a really important muscle, and this is why you want to think about strengthening the calves, because this particular muscle crosses the ankle joint and has the ability to lift the foot up. And after doing all the different exercises of creating that arch, you're going to have activated this muscle in such a way where you're going to be you'll be using this a little bit more than just your gastroc and soleus muscles, which they're going to work also. They're going to be the main ones that are working. But we're wanting all of them, all the muscles back here that cross that ankle joint to be working, okay? So if we go through all of them, so see how it might not look as clean as we want it to, okay? But you see these muscles, here's the ankle joint, right? And you see how it attaches to the calcaneus, the heel right here. That's crossing the ankle joint, okay? And then all these muscles here cross the ankle joint, all right? And they're all going to be helping and getting these muscles stronger, which in turn will help create arch in that foot and eliminate the plantar fasciitis symptoms that you might be experiencing. Let's go and check out the exercise. So we're demonstrating it being one-legged. That can be a little stressful. You can do both legs. raising the heel up. Don't think about pushing the toes away. If you think about pushing the toes away, you'll have a tendency to use mostly toe muscles. And yeah, there's a lot of toe muscles that cross the ankle joint, but the big focus here is the muscles, all these muscles back here. Okay, so you want to think more about lifting the heel up and then pushing the heel down. All right, controlling both the concentric, which is the shortening phase of lifting the heel up, and then the eccentric, which is the lengthening phase of pushing the heel down. All right, so you can do it both-legged if one leg is too stressful, and if you can do it off of, if it's not difficult enough, one-legged flat on the surface, then you're not doing it right. Okay, if you truly have a plantar fasciitis problem and your foot is so weak that it can't even create an arch, then it's too weak to go in a depth drop, like on a step or something like that, to drop your heel down low and come back up. All right. So if this is too easy, you're doing it wrong. Just going to be honest with you. Okay. Let's watch the video. Controlling going up, lifting that heel up as high as you can. Pause for a couple of seconds at the top. You don't have to wait for like 6 seconds or anything like that. Just so like a 1-2 count, and then control it back down. All right. Now, if you look at the person, it really looks like she's gathering herself and throwing her whole body forward while she's doing it. You want to try to kind of minimize as much movement as you can with the upper body, and just really thinking about that heel coming straight up and then heel coming straight down. Again, once you get to the top, 1-2. Once you get to the bottom, 1-2. Always keeping the muscles tight. All right. You can let it relax and rest when the set is done. All right. Okay. And then last but not least, let's maintain that mobility and do some gentle stretching. Okay. So you can use a towel, be seated. This is going to get the back of your knee. Let's see when you do this one. So we go down these different layers. Oop, too many. Okay. See that? Well, the plantaris, that's attached right behind your knee. Then you have the popliteus. That's a fun one to say. Those are what you'll be feeling like in the back of your knee, lengthening and stretching. It does come down, this popliteus does come all the way down. You see that tendon, and it attaches right onto the heel right here. Let's see. So you'll be stretching the whole calf. That's the soleus. But yeah, you'll be stretching everything right through inside here. But then you'll also be hitting that plantaris, which is right behind the knee. You might feel your hamstrings. These are your hamstring muscles. Okay, semitendinosus, semimembranosus, bicep femoris, and then, let's see, there's a list bicep femoris shorthand. No, that's adductor magnus. Okay, no big deal. A really deep muscle. Okay, so let's check out that exercise. Let's watch a video. Notice a towel around the toes. You're relaxing the foot, and all you're doing is you're flexing that quad and pushing your heel away. All right? It's not about pulling the foot towards you. See how her arms are straight? She's not bending the elbows, right? She's holding it there, and she's just pressing like a leg press, pushing the foot away. Again, in order to create permanent lengthening, good mobility stuff, you got to shorten the opposite muscles, right? So she's flexing that quad and then pushing that heel away, which in turn will cause all those muscles on the front part of the body to shorten, which will then allow all these muscles on the backside to lengthen. All right, let's watch the video and see how she does it. Nice and control, holding it for, you don't have to hold it as long as she's kind of doing it. I mean, it's beneficial to hold it for up to like 30 seconds, but I find the most benefit is more like 6 to 10 seconds. That just seems to be the magic number for people to improve their mobility. 30 seconds, it can be a little long, in my personal opinion. Yeah, so those are all the exercises. So let's go over them again. So the myofascial release, rolling your foot, doing that daily, 60 seconds at a time, 3 times the foot. Toe crunches. Okay, you can do this one daily, but you want to do it in the very beginning, like 3 days a week. Rest 30 seconds in between each set. 10 crunch squeezes per set. Okay. Then shortening the foot or creating that arch inside the foot with your own might. right? I would say hold it for like 5 or 6 seconds. 6 is better than 5, but at least 5 seconds. 10 repetitions of that, doing 3 sets of that daily, 30 seconds rest in between. Truthfully, you can get away with shorter rest on this one just because your foot takes a lot of abuse, right? You're on your feet, standing and moving, doing things all day long, so they can take a lot of abuse. So if you feel good after 15, 20 seconds, go ahead and try doing it again. If you start feeling like it's a little too much, then back off and do a minute, right? It's not important. What's important is seeing progress, all right? Standing calf stretch, we're just going to do 1 set here, 3 repetitions, up to 30-second holds. Again, I see more of a benefit of holding it for about 6 seconds. You can do longer, but I see the most bang for your buck at just a 6-second hold, to be honest with you. So that's what I would do. Same thing with the Soleus Stretch, dropping that knee forward, squatting your butt down. 3 repetitions, 1 set daily. Then the single leg balance, again, trying to hold that arch in your foot and holding it there for, 30 seconds is a really long time. That's the end goal, but I find, again, the most benefit is about 6 seconds. Do 5 repetitions like that. And then once each foot, or once for the foot that's bothering you. It should be really easy to do it on the stronger foot, the one that's not bothering you, but test it out and see. If you find that there's some range of motion issues on that one as well, or you have some instability, then do that one as well, okay? Then single leg heel raise. You can do both legs if you need to. 3 sets, 10 repetitions. Hold for a 2 count up top. Hold for a 2 count at the bottom. Always keeping the calf muscle flexing the whole time. All right. You don't want to relax. You rest at the end of the set for 30 seconds. Okay. All right. And then nice simple towel stretch. At most 30 seconds. But again, I find the biggest benefit is 6 seconds at a time. Just do like 3 repetitions, no big deal. That'll give you the most bang for your buck. All right?
All right, that's it. Thank you so much for making it to the very end. So those are the top exercises and mobility exercises to do to eliminate plantar fasciitis. But again, if they don't work for you, then it's probably because there's some kind of underlying issue that's also contributing to that foot issue. And normally it's something to do with either the hip or with the trunk and spine. Okay, I look at the whole body as the feet are kind of like the foundation of a bridge, right? And then like your knee or your hip is kind of like the bridge itself, or in this case your ankle, right? Is like the bridge itself that we all pay attention to and we see and we notice and everything. And then the muscles above it are like the suspension system, all right, for a bridge. Now the suspension system goes, so does the road. If the foundation goes, so does the road. Okay, and then if the road goes, well, then the road goes, right? But all 3 of those areas, so the bottom of the joint, the top of the joint, and right in the joint itself, all have the ability to contribute to the problem. So if this doesn't really help and get relief, then you need something that's personalized and more for you. All right, so thanks a lot. I look forward to talking to you again soon.